Hello everyone. I'm Esma. Last time, I talked about what alcoholism is. Today, I'll be talking about what is done in alcohol treatment. So, what kind of treatment is used for alcoholism? At our hospital, we mainly inpatient patients for the purpose of abstinence. Recently, many hospitals have set up outpatient clinics for alcohol reduction treatment. In addition, we also have patients who come to our hospital with the purpose of reducing their drinking. Compared to before, the barrier to visiting a hospital has become lower because more people are visiting the outpatient clinic with the purpose of reducing their drinking. Abstinence means not drinking alcohol for the rest of your life. Drinking reduction means reducing the amount of alcohol you drink. Treatment for abstinence involves physical treatment, dealing with withdrawal symptoms, and psychosocial treatment. Alcohol harm education, individual psychotherapy, group psychotherapy, participation in self-help groups, drinking reduction treatment, psychosocial treatment in alcohol reduction treatment, setting goals for alcohol intake, checking alcohol intake, checking medication intake, overall improvement evaluation, re-evaluation of treatment goals. Treatments are combined and implemented according to the patient's treatment. It takes a long time to recover from alcoholism. So, everyone, do you remember what are the diagnostic criteria for alcoholism? In fact, there are few people who are aware of their alcoholism and hospitalize themselves. So, when should you be hospitalized? For example, even if you have been drinking the same amount and for the same period of time. There are differences in the timing and the difficulty of symptoms appearing depending on the person, due to detoxification by liver function and differences in genes. On the other hand, liver function declines and abnormal test results are seen. And mental, auditory, hallucinations, and physical symptoms appear. When you become alcoholic, physical, mental, and social problems appear. Alcoholism is a disease in which a person develops a tolerance to alcohol and gradually increases the amount of alcohol consumed, progressing without the person realizing it. So what is the process of addiction? The border of addiction drinking becomes a habit. Early addiction psychological dependence. Middle addiction physical dependence. Late addiction life falls apart. This is the process. The desire to drink alcohol is so strong that it cannot be controlled by oneself psychological dependence. And when one stops drinking alcohol, symptoms such as irritability and anxiety, trembling hands, sleeplessness at night, sweating, vomiting, etc. Withdrawal symptoms appear physical dependence. In order to recover from this type of dependence and regain physical health, it is necessary to abstain from alcohol. To do this, inpatient treatment under the supervision of a doctor with specialized knowledge of alcoholism is selected. If the patient's physical and mental condition is relatively stable, and the patient and his/her family are able to improve their lifestyle by following the doctor's instructions, treatment may be performed on an outpatient basis without hospitalization. There are two options. Now, let's talk about the treatment of alcoholism. The basic treatment consists of the introductory phase, the detoxification phase, the early rehabilitation phase, and the late rehabilitation phase. 1. Introductory phase. We help people understand the disease and motivate the patient to undergo treatment. Motivation for alcohol abstinence treatment. Recognition and understanding of the disease. 2. Detoxification phase. In order to deal with withdrawal symptoms, treatment begins with the goal of abstinence. At the same time, treatment is continued to improve comorbid physical and mental symptoms such as tremors and delirium. Beginning of abstinence. Withdrawal treatment. Treatment of complications. 3. Early rehabilitation phase. After symptoms such as withdrawal symptoms have improved, we begin full-scale efforts toward abstinence. We provide correct knowledge about alcoholism, encourage a realistic understanding of the drinking problem, and support the resolution of problems in daily life. We take a broad, long-term perspective and consistently treat the addiction itself, including the family. Abstinence, mental stability, improvement of social life skills, treatment of psychological dependence, through occupational therapy and cognitive behavioral therapy, treatment of physical disorders related to alcohol. 4. Late rehabilitation, focusing on how to cope with and prevent relapse and how to deal with problems within the family. The aim is to continue abstinence while acquiring stress, coping behaviors, recovering the family, and stabilizing life. Continued abstinence, acquiring stress coping behaviors, recovering the family, preparing for social reintegration. Treatment proceeds in the above steps. Psychosocial treatment is the core of treatment for alcoholism. Psychosocial treatment aims to help patients acquire the habit of not drinking alcohol, build and maintain good human relationships, and overcome the stress of social life. In order to maintain and support the patient's desire to abstain from alcohol, treatment is carried out by combining several of both. 1. Alcohol harm education. Alcohol harm education is about learning about the problems caused by drinking and the disease of alcoholism. 2. Individual psychotherapy. Individual psychotherapy is counseling that is conducted individually. You can talk to a psychiatrist, clinical psychologist, licensed psychologist, etc., and receive individual advice. 3. Group psychotherapy. Group psychotherapy is the core of psychosocial treatment, under the direction of doctors. Several patients discuss various issues and think about abstinence and recovery. 4. Participation in a self-help group. Participating in a self-help group means attending regular meetings, talking about your own experiences, and listening to others' experiences. You can reflect on yourself, make friends with people who have the same illness, and support you in continuing your abstinence. In this way, psychosocial treatment is very important. In addition, cognitive behavioral therapy, which reviews and corrects thought patterns, has been adopted as a psychotherapy method. It is a treatment that reviews the patient's cognition, that is, their way of thinking and behavior at the same time. In cognitive behavioral therapy, the patient examines their own cognition, perspective, way of thinking, and values regarding alcohol, and aims to improve their future behavior and life by changing their cognition. By making the patient aware of their own cognitive bias, the patient's motivation to abstain from alcohol is improved. In the process, the patient is able to think more deeply about the purpose of continuing abstinence and ways to prevent drinking. By receiving appropriate treatment, you can safely recover from alcoholism. If you suddenly stop drinking alcohol on your own, you may experience dangerous withdrawal symptoms. So we recommend that you consult with a specialist as soon as possible, whether it is outpatient or inpatient treatment. First of all, make a connection with a medical institution. Early detection and early treatment will lead to your early recovery, more than anything else. In some cases, the disease progresses without you realizing it, and you may not be able to see a doctor. The cooperation of those around you is also very important. Even small things are fine, so don't keep it to yourself. But first consult with a medical institution. How was it? Today we talked about the treatment of alcoholism. I didn't get to talk about family members. So next time I will definitely talk about what the family members of alcoholics should be careful about. If you enjoyed today's video, please subscribe to my channel if you haven't already. Also, if you click the like button, it will be a great encouragement. See you in the next video. Bye.